Acrobat Connect has made it possible for us to re-engineer the way training is conducted in clinical research. Medpoint Communications is a medical education and training company. We support pharmaceutical and biotechnology companies that are developing new drugs. And that's a challenge because the clinical research sites are scattered across the country and across the world, and they all have to be executing these complex research protocols. Clinical research is really a foot race against time. 6 weeks can mean a lot to drug developers in completing research and getting a drug to market. As a matter of fact, those 6 weeks can be easily worth $1 million a week in value to our end clients, the drug developers. Having planned hundreds of investigator meetings throughout the 1990s, we were continually struck with there's a better way to do this from a training perspective. We've moved from the traditional way of flying people around to attend long meetings that take a big chunk out of their week of treating patients and that are very expensive, and we're moving to a model where we're able to support it virtually without people having to travel.
We have 3, New York, Washington, and Florida. 1 speaker in Germany.
Just recently, Medpoint conducted a training for one of our clients, which involved 15 regional locations. We were able to train over 500 physicians at those locations, and our clients were very pleased because they were able to train these physicians in a clear and concise and consistent manner using Acrobat Connect. There are many reasons why Medpoint chose Acrobat Connect, and a lot of those have to do with the Flash architecture, the de facto standard for rich media on the internet. The free player is already installed on most of our clients' and attendees' computers, so we don't have to go through any long, difficult downloads, possibly getting IT involved for someone to attend one of our meetings.
We've used 3 different platforms. The latest has been Acrobat Connect, and we have found significant decrease in any sort of technical assistance that we've had to provide for people to join. Our phones don't ring for technical support.
One of the nice things about Acrobat Connect is really the video is plug and play. Really any type of webcam, you can just plug it into your computer and go.
A lot of our experience assisting our doctors to one of our e-meetings is, all right, do you see the first slide of the presentation? It's just that easy. You've joined our meeting.
Our activities are extremely global. So we need a technology that we can take anywhere and that's going to work in some pretty exotic locations around the world.
When you're conducting clinical research via web conferencing, engaging your audience is important. We'll use features such as the chat feature or the polling feature, ensuring that we're using the markup tools, whether it be the arrow pointer or the whiteboard.
It's very rich and interactive, so pretty much anything you've seen done in Flash, we have the possibility of bringing something very similar into a Connect meeting.
The physicians and the coordinators are better trained. They're better prepared to launch the studies. That means the studies get started faster, they enter patients more quickly, they have fewer problems, and overall the safety of how patients are treated with investigational drugs is improved greatly. Acrobat Connect is the backbone of what we do at Medpoint. It's hard to imagine what we would do without a system like this, and it's hard to imagine ever taking a step back in time.